Greetings, greetings, family. We are live. Welcome, welcome to the Sister Shanice Show. We are delighted to be having another Wednesday session with you all. As you can see, my wonderful, fantastic, blacktastic guests are in the house. We are ready for a really interesting, deeply insightful conversation with you. We love you. We would love you to interact with us via the chat. Let us know that you're in the house. Tell us where in the world you're actually watching us from. And, family, this is a serious topic that we're going to be discussing today. Racism in the NHS. Wow. This is the same National Health Service that wants us queuing up for the you know what it is we're talking about there. And so can we really trust this particular institution? Can we trust, or believe all that they say to us? Do they really have our best interest at heart? Is this the sort of institution that we would want to put our life, our hands in? It may well be, but, in doing so, to what extent can we really have confidence that they are going to be looking after our best interest? We will. You know what? We're going to leave you to be the judge of that today, but we are ready for a very deeply insightful conversation. And as you come through the door, you're going to have to watch the replay, because I'm going to kick off to a very early start, because we have got a lot to get through today. So keep it locked to the Sister Shanice Show. Don't go anywhere. In fact, ring your friend, ring your brother, ring your sister, ring your mother, ring your auntie, ring everybody. Let them know, say, we're live right now, okay? We're going to be talking about the sort of stuff that you're not going to hear anywhere else, all righty? The government institutions, the Quango organizations, the health organizations, they're not going to be having the sort of debate that we're having. So let everybody know to lock in. Yes, let's welcome Sister Hilario. Take yourself off mute. Please do introduce yourself to our audience.
Hello, everybody. Thank you for coming in to watch us today and to listen to what we have to say. My name is Hilario Asumu. I am the director of Safe House UK, and I'm going to be talking this evening about racism in the NHS. I started my company about 6 or 7 years ago, and I look after different people, different employees across Greater Manchester from different organizations. And my organization provides advice, support, advocacy services for our brothers and sisters in the UK who have issues within their own organizations. So we provide advice on employment law, on HR issues, absence management, disciplinary, and grievances. And most of our brothers and sisters in the UK don't even know that there's a service like this right here in the UK, there to help them to, fight back and, get justice for those injustices they have to go through in their organizations. So I'm here this evening to talk about racism in the NHS, and hopefully, try and clarify a few issues around that. Thank you very much for listening to me.
Hilario, welcome on board. Please do mention the name of the organization. How can people get in touch with you should they wish to do so?
Yes, they can reach me by email, info@safehouseuk.co.uk, or call me on 07890 791 741. We have a website, but it is a page, and we're just developing that now. And I would send that information out to you, Sister Shanice, once it's ready. Thank you.
Thank you so much. And please do put that telephone number and the email address in the chat, and I will post it in the public chat and also in the description box below, so the family members can actually access it. Wonderful. Welcome on board. Okay, let's go over to Dr. Vivian. Please unmute yourself, Dr. Vivian. Welcome.
Thank you very much. Thank you for the invitation to give a presentation this evening, and good evening to all the listeners. A little bit about me. My name is Vivian Life-Sisse. I'm one of 7 siblings, the 5th in line, born and brought up in London to Jamaican immigrant parents from the Windrush generation. In 1980, I came to Brighton to study biochemistry at the University of Sussex, and I decided to make Brighton and Hove my home. So I've lived here for 41 years. I worked in the local NHS trust for 34 years, 31 years as a clinical biochemist, and the last 3 years within senior management. Unfortunately, in 2017, I was unfairly dismissed, and we'll talk about it this evening because of my activities around exposing the institutional racism in the NHS. And my fight continues, starting again in January 2022. Very much looking forward to the discussions that we're going to have this evening.
Wow, wow, wow. We're certainly looking forward to hearing from you as well, Sister Vivian. We need to know more about, what was going on in the NHS. Wow. Let's go over to our resident panel member, Dr. Abu. Rise up, Dr. Abu. Please introduce yourself, just in case we've got some new viewers today.
Voodoo Empresses, rise up family. And to all the family them that is in the audience, my name is Abu Ratat, presenter and radio, work in the community. And I'm here as a witness. I'm here as a witness to the horror that our people going through in the NHS, and rise up to the Empress them who is there to voice out the truth of what happening to us, because somebody to say something. So I salute them.
Voodoo, rise up, Dr. Abu. Yes, we do. We commend our empresses. We commend our queens, for their bravery, because, we're living in a society where they give you the impression that you have the right to voice any concerns that you may have. But when you do, you face the consequences of doing so. We're going to be hearing more about that today. Not before we welcome on board our Queen, Enzinger. Welcome, Queen Enzinger.
Greetings, family. Dr. Abu, I'm just going to suggest that you mute because we're still getting that vibration. Yes, greetings, family. My name is Enzinger Asata, and like Sister Vivian, I was actually born in Jamaica, so I wasn't born here, but I came here in 1959 as a young child, so I've lived most of my life here, and I've actually personally acted against racism in the health service, and I'm actually going to share with you later a letter that I wrote, which was featured in the Nursing Times in September 1995, highlighting the issues, and also my thesis, which I got a first for my degree, a BA in social science, focused on whether we actually were getting any opportunities in employment. I was a health visitor in the community health service in particular, because although we were well qualified, we never seemed to get to the higher positions within the system. And so my research focused on what we thought about that and what was our opinion. So I'll share some of the conclusions and recommendations from that as well, because it very much is about what we're all saying today. And that was way, way back when. So thank you very much.
Thank you very much as well, Queen Enzinger. So yes, we will be going on a journey tonight, and we'll be seeing and assessing for ourselves the extent to which, there has been change, if any at all, and whether things are getting better or worse for us as Africans, Black people, within the NHS. So we're looking at the National Health Service in the UKKK tonight, and let's welcome on board some of our viewers in the house. So family, let us know where in the world you're actually watching us from. Let's rise up some of the family members. I can see we've got Ace 99 in the house tonight. Should be very happy because we're talking about an issue that's pertinent to the UK, and this is someone who often says, why don't you focus more on what's going on here in the UKKK? So we're doing that tonight, so he should be very happy. Rising up, Sister Afrojamo. Rise up, Sister Afrojamo. I know, watching us all the way from Ghana. She's saying, greetings, Sister Shanice and panel, my real African brothers and sisters in the chat. Yes, watching us from Ghana. Miss Sis, waiting about where the president just recently announced, huh? Everybody in the public sector in Ghana has got to get the big V, yeah, and all of the residents and those returning residents and citizens have also got to get the jab. What do you say about that, my sis? What are people on the ground saying? Wow, 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 making it compulsory. We've got to watch what's going on in Ghana. Many of us were going to be heading to Ghana, you know, as part of the return, the big return and the diaspora investment that Dr. Arikana Kwe is organizing. But some of us have got drawbreaks now. Know that we have the something there before we can go. We may talk about. Anyway, let's carry on. So, Uns, welcome. You're saying greetings, everyone. Brother Geb, I know you're watching us from Canada. Is it America? Rise up, Brother Geb. Yes, Sister Afrojamo, asking everyone to please like and share. Thank you so much. Yes, let's welcome Ruth in the house. Sister V, welcome, welcome. Natural Mystic, welcome. Maxine, watching from London, welcome. Come on, family, let us know where you're viewing us from. Anyway, because we've got a lot to go through, remember, if you've got any questions, if you've got any comments or points, family, please put your comments in the chat, okay? We will be keeping an eye on the chat. We will be posting some of your questions or putting your points to the panel. Alrighty, so without further ado, we are going to start this evening with a presentation from our sister, Dr. Vivian. So let's add the presentation to the screen and allow our queen to go through her presentation. Take yourself off mute, sis, and take it away.
Thank you ever so much. Well, the title today is talking about racism in the NHS, its implications for African, Black staff and patients. Next slide. Several acts have been passed by the UK government over the years, over the decades, to try and improve the race relations in this country. But we all know that things are not well, and it is a fact that most organisations, most institutions are institutionally racist. So these acts haven't really helped to progress this issue in this country. Next. And we know that in Sir William Macpherson, who looked at the issues concerning how the police handled the situation in terms of the death of the Black teenager, Stephen Lawrence. And it was Sir William Macpherson who said it was the institutional racism in the police that failed Stephen Lawrence. And he defined institutional racism as the collective failure of an organisation to provide an appropriate and professional service to people because of their colour, to people because of their culture, and to people because of their ethnic origin. He said that institutional racism can be detected in processes, their attitudes, their behaviour, which amount to discrimination through unwitting prejudice, ignorance, thoughtlessness, and racist stereotyping, which disadvantages minority ethnic people. In fact, it was the events around Stephen Lawrence that resulted in the amendment of the Race Relations Act to give the Race Relations Amendment Act 2000. And as a result of that, all public sector bodies, including the NHS, were asked to look at the institutional racism within their organisation. Next slide. So over the years, the NHS has introduced initiative after initiative in an attempt to address the institutional racism that exists. But don't be fooled, actually, when I say that the NHS introduced these strategies or these initiatives to address the institutional racism, because the NHS has never ever admitted that it's institutionally racist. But all of these initiatives have failed, including the latest initiative, which is the last one on the list, the Workforce Race Equality Standard. The WRES, the WRES. This is the current initiative being used by the NHS in an attempt to address the institutional racism that exists. And alongside all of these initiatives was the direction from the Department of Health that all NHS organisations should set up NHS BME networks. And this is where I came in. In 2004, I put myself forward to be the chair of the local BME network in Brighton. And then I was elected to that position. In 2005, I led on the establishment of a regional network, the South East Coast BME network. And then in 2010, I led on the establishment of a national network, the NHS BME network. And it's been our fight over the years to expose the institutional racism in the NHS. And it's because of my fight, along with my colleagues, to actually expose that racism that ultimately led to my dismissal in 2017. But the fight is on. Next slide, please. In fact, actually, when I took up this agenda, my consultant biochemist told me it was the worst thing that I was going to do. I just won the Young Biochemist of the Year, a national competition. He said, Vivian, we want you to be the first woman of the Association of Clinical Biochemists, and we want you to be the first person of colour to hold that position. And he warned me, he said, if you take this agenda up, it's going to ruin your career. He was right, it did ruin my career, but I can honestly say, ladies and gentlemen, I have no regrets. And one of the things he said, if you're really going to do this, Vivian, promise me, don't come at it feeling an emotion. You're a scientist, come at it based on evidence. If you can prove based on the evidence that BME staff and patients are being disadvantaged, that's where you're going to win over the audience that are skeptical about all of this. So I took up the challenge. In 2007, I sent out a Freedom of Information request to the 27 chief execs in the South East Coast region. And I asked them for their data around how they were treating BME staff compared to white staff. So for example, I said, please give me all your data from over the last 5 years concerning how many staff you disciplined by their ethnicity. Took me 8 months to analyse that data from 27 NHS organisations. My report was published by, I gave it exclusively to the Health Service Journal, and this was the header: Minority staff get worse deal on jobs, pay and grievances. It was also picked up by Channel 4 News. Then what the HSJ, the Health Service Journal, said, next slide, they said, can we use your template, Vivian? And we're going to look at all NHS organisations. So in 2008, when this was published, there was 231 NHS organisations. They collected the data, they analysed it, and this was their header in their journal in November 2008. Survey shows racism alive in the NHS. What's the date? What's the year? 2021. This was 2008. So nothing has changed. Next slide, please. So just to say what my report actually showed, it said at the time in 2008, I found that BME staff for the 27 organisations I looked at made up 15% of the workforce. And I have to say, I wasn't naive. I knew we were facing racism, but I couldn't actually believe my own data. Because what it actually showed was BME staff were disproportionately represented on disciplinaries, grievances, bullying and harassment, capability, employment tribunals. BME staff were less likely to be appointed from a shortlist. Now, if you're on a shortlist, it must mean that you've got the qualification and experience to get the job. But every time you're to be appointed, the white man gets it over you. BME staff are grossly underrepresented at the lower pay bands. grossly underrepresented at the higher pay bands and overrepresented at the lower pay bands. And there was a failure of organisations to be collecting the data to look at all of this. Next slide. I looked at some of the experiences around what these organisations were doing to engage the Black and minority ethnic community. And in a nutshell, it was absolutely nothing. Next slide. So let's fast forward to 2015 when the WRES was actually introduced. This was, like I just said, one of the initiatives to address the disadvantage or the discrimination of BME staff in the NHS. So you can imagine if I'm exposing this along with my colleagues, based on the evidence, we are not popular. I'm a black marked woman, I was, in the NHS. So they've got their WRES. So what happens with the WRES is every year since it was introduced in 2015, NHS organisations have to send their data up to the centre, NHS England, they analyse it, they publish, saying, what is this data telling us when you compare, say, disciplinaries for Black and minority ethnic staff against disciplinaries for white staff? What is it telling us when we look at the appointments of Black and minority ethnic staff and white staff for the jobs that they apply for? And every year, the data tells us that the NHS is failing our Black and minority ethnic staff. Every year, next slide, please. What it's actually showing is that, so this will vary from NHS organisation to NHS organisation. So this is an overview of what these findings are for the WRES. So not every organisation will show this. They may show one or two of this, they may show all of this. But there isn't one NHS organisation that we can point to as an example of delivering race equality for its Black and minority ethnic staff. So what the evidence is showing is BME staff are 2 to 4 times more likely to be disciplined when compared to their white staff. BME staff are more likely to report experience of discrimination, harassment, bullying, and abuse from staff. That their colleagues at the same level, managers, that's what they report. They're being discriminated on a daily basis. They are less likely to be appointed from a shortlist. From a shortlist. BME staff are less likely to report their organisation provides equal opportunities for career progression or promotion. And the NHS boards that have to take responsibility for making the decisions on a day-to-day basis do not represent the workforce. In fact, in November 2020, there was a study done by the Health Service Journal. 45% of all NHS trusts have no Black and minority ethnic people on their board. And they say they can represent us. Next slide, please. So it's not surprising to see that over the years, given this situation, that there have been review after review about race in the workplace, what we're going to have to do to address it. One of the best reviews, I think, was done by Baroness McGregor-Smith. And she said this: any organisation that is publicly funded must set and publish targets to ensure they are representative of the taxpayers they deliver for. The government must legislate to make larger businesses publish their ethnicity data by salary band to show progress. And much of the bias is structural and a result of a system that benefits a certain group of people. If Black people think that white people are just going to give up their positions and their power to accommodate us, then we're more fools than one can imagine, because it's not going to happen. None of this is equality is not going to be achieved without a fight. But one of the things that I was told time and time again, well, Vivian, from Black and minority ethnic people, not the white people, from Black and minority ethnic people, you see, Vivian, it is bad what's happening to us, but we've got to try and work with them. We've got to try and win hearts and minds, because that's the only way we're going to succeed. It's complete nonsense. But you see, the system can rely on Black and minority ethnic people sitting back and believing that somehow some miracle is going to happen without them doing anything about the situation they find themselves in. What Baroness McGregor Smith said, it is time for organisations to stop hiding behind unconscious bias. So when you look at the data and what it shows, are we really saying, ladies and gentlemen, that all of this has happened because somehow white people unconsciously do this thing to us? They don't know what they're doing. You know, it's just that this is the end result. They are consciously discriminating against us. Next slide, please. So in the last few minutes, I want to bring us up to speed with, I'm now going to jump. What I will say to you is we all know that when the pandemic hit last year and our BME staff were dropping like flies for the first time, we were hearing NHS is racist. When we were talking about the ethnic health inequalities, we've been shouting from the mountaintop since 2010. All of a sudden, Black leaders who didn't want anything to do with us, all of a sudden we found out that they had suffered racism. You know why they were speaking out? Because it was safe to do so. They wouldn't speak out before because they didn't want to get targeted. But when they realized that everybody was talking about racism and everybody was upset about the tragic death of George Floyd, then they thought it was safe to come out and tell their white colleagues that we were discriminated against too. That's what we do. We hide, we say nothing until it's safe to do so. So you can see, I'm just going to give you a flavour of what's happened since March 2020, when everybody started talking in this country about we must do something about the racism that exists, to the present day. If we look at the situation for staff, the latest Red report published in 2020, under 2020, shows there was little improvement and even some of the results had deteriorated. NHS Lincoln has appointed a new lead. It's a Professor Anthony Manuel. He's the new lead for the WRES. A few weeks ago, he said, NHS England is pussyfooting around. I quote, that's what he said, pussyfooting around the release of a race equality strategy for the NHS. It's not happening. The Royal College of Emergency Medicine reported that, you know, part of the reason why our Black and minority ethnic doctors were dying disproportionately was because they couldn't get PPE, personal protective equipment. They were being denied it, but sent to the front line while it was being given to their white colleagues. Ladies and gentlemen, present the evidence. They cannot argue with us. This is what the evidence shows. BME doctors feel less protected than white doctors. 45% of NHS trusts have no senior Black and minority ethnic managers, very senior managers. Next slide. There was a report, a WRES report, just for BME doctors. Oh, surprise, surprise. There were 11 different things that they looked at, and for everything that they looked at, BME doctors fared worse. A study by University of Surrey showed that Black surgeons are promoted far less than their white colleagues in England. A Royal College of Psychiatrists report found a third of BME staff in NHS mental health services face racist abuse at work. And we as a network got involved in an inquiry by the Equality and Human Rights Commission, the regulator in this country. This year, I think it was around July, they approached me. I asked our BME staff that are in the lower pay bands to take part in this study. They still have not published the report. There were 3 commissioners that led that report for the EHRC. One commissioner, this is an article in The Guardian recently, she has left. She's taken them to an employment tribunal, and she announced by sending an email to all her colleagues that left that the EHRC is colluding with the government in denial of institutional racism. And on the 8th of November, just to bring us up to date, there was a report published by the Nuffield Trust that said at every level, BME staff in the NHS are being discriminated against. Next slide. So what is it for patients then? What is it looking like for patients? Already Sister Shanice has gave reference to the fact that there are high Black women, Black pregnant women have higher risk of death 4 times. And yet what's being done about it? Nothing. But the charity Birthright is actually carrying out an investigation. A study by the Lancet showed that BME people are more dissatisfied with GP services. There was a report by Baroness Doreen Lawrence into the impact of the pandemic on our communities. And this is what she says, what she found. BME people overexposed, underprotected, stigmatized, and overlooked during the pandemic. But she said, hold on a minute, this is not just about the pandemic. This has been going on for generations. What's happened is COVID-19 exposed the institutional racism in the NHS. The Parliamentary Joint Committee on Human Rights, give them their credit. They actually said to the EHRC, you are failing on race. And in fact, race needs to be taken away from you. And a body such as the Commission for Race Equality, a body like that in the past needs to be set up again. The government is now consulting on a white paper on mental health. And in there, it's talking about how is it going to address the disaster, that's the only way I can describe it, the way in which our Black men in particular are being failed and let down by the mental health services. All the time we sit back and do nothing. Next slide, final slide on this. More recently, the Health and Social Care Secretary, Sajid Javid, said he's launching a review because he said some of those medical devices are not good for us. There's systematic bias. Some of them don't work on dark skin. How long have we been using them? The NHS Race and Health Observatory is also looking at, is carrying out a review into IAPS and neonatal care of ethnic minority babies. Some of the ways in which we monitor the health of the babies, it's shown that it's not suited for Black babies. It's suited for white babies. How long we've been doing this? Then the sickle cell, you would have seen that over the news more recently. That report finds serious care failings in acute services. And then it concluded that this was underpinned by racism towards the predominantly African and Caribbean patients. The government has launched more recently, I think it was the 1st of October, an Office for Health Improvement and Disparities. And they said they're going to be looking into the wider determinants of health to reduce the inequalities that exist. But look the situation we find ourselves in. The last point, when all of this happened last year, the government said it was going to set up a commission on race, on ethnic disparities, to report on what's going on in the UK concerning race. Led by a Black man, 12 people on the committee, 11 BMEs, 1 white man. And what did they come up with? Britain is no longer a country where the system is deliberately rigged against ethnic minorities. And it also said they found no evidence of institutional racism. Next slide. So what next? What are we going to do to address this awful situation that we're in and have been in for a long time? I have no doubt that the only way in which we can overcome is if we were to rise up and do something for ourselves, set up a system that would address our needs, understands our culture. That's ideal. There's no 2 ways about it. That's the only way we will overcome. But sadly, and I stand to be corrected tonight, from my experience of fighting in the NHS, and when I stuck my neck out for BMEs, I have no regrets. I'm no hero, but that is what I did. When it came for them to stand by me, some of them told me, Vivian, we appreciate everything you've done, but I've got family in Africa. I can't lose my job. I can't be seen to side with you. I can't speak out. We feel sorry for what's happened to you. And we really believe that we're going to be capable, unless us as Black people change our mindset. You know, we've got everything going for us. everything. Look at what they do. They're copying everything we have, what we're about, and yet we can't recognize exactly what we've got on our own value. We're going to get nowhere. You can correct me tonight. We're going to get nowhere unless we change this mindset. Thank you ever so much. Next slide. Thank you so much for inviting me to give this presentation this evening.
Oh, my sis, round of applause to you. We thank you so, so much for sticking your neck out. You put your job on the line. This research, this very comprehensive research that you did cost you your job. And I'm sure, you know, probably even impacted on your health. You did it for us. And so many of the very same people who you were trying to represent just stood by the fence and said, sorry, you know, I can't stand with you on this. You were fighting for everyone, and when you needed the support, they weren't there for you. Well, we are here for you, Dr. Vivian. We rise you up for your great works. Your sacrifice will not be in vain. That report is a testimony of the systemic racism within the NHS. And it's up to us now to use that information to embarrass the government, the institutions and the organizations, especially when they want to try and suggest that racism doesn't exist anymore. You know, enough respect to you for the works, my sis. The evidence is there as a testimony now of racism within the NHS. We're going to come back and have more of a discussion on this, and I'm going to be bringing in some of the comments from the chat as well after the next presentation from our sister Hilario. Okay, so put your questions, family. Those of you in the audience, put your questions in the chat for Dr. Vivian. Any comments on her presentation, even just to give support to the sister, please put your comments in the chat. We will be coming back to your comments. But for now, let's go over to our sister Hilario. Please take yourself off mute, and over to you, my sis.
Okay, good evening, everybody, and thank you again for having me on. Now, I don't have the same experience as Sister Vivian, but I don't work for the NHS, but I have my own experience from the police force, and I became a kidney disease patient from the stress in my job, and unfortunately, due to the stress, I lost a pregnancy and had multiple organ failure, you know, was in a coma for 2 weeks. And when I came out, I was a kidney disease patient. Now, that, you know, was as a result of the institutional racism, which at that time was not recognized. I was made redundant because of my pregnancy-related absences. At that point, I didn't want to fight it. I thought I needed to go because this had happened twice in 2008 and 2010. And most people know me. And, you know, in the course of that time, I was the chair of the Black and Asian Police Association. And what was happening was I was getting people off, you know, challenging the system and getting a lot of our members off the you know, the disciplinary routes, kicking them out of the organization or sending them to obscure divisions where they find it difficult to take their children to school or do anything at all. So I think that might have been the reason that, you know, things happened the way they did, because I was working 2 jobs. So in that way, I was advising people. My background is HR and employment law. I was advising people. I was following them to disciplinaries and stuff like that, and making sure that, you know, whatever decisions are taken, that they are fair and they are actually really, you know, they are actually fair to the crime or whatever the offense the person committed, or whatever rule the person broke, or if it's the absence management. So because people were getting off, they didn't like that, and they had to get me out of the organization. I was made redundant and I moved on. So when I left the organization, I started, I'll just take you through. I started working with people in the community and in other organizations. And in the course of my work, I found out that a lot of people in different organizations across the UK, we're finding it very difficult to actually defend themselves. They don't know the policies, they don't know the rules, they don't know how things work, they don't even know the processes in their organization. So I took it on myself to start advising people and supporting them through the different processes in the organization. And in that way, I was able to help people challenge, by themselves. Now, one thing we have in the UK are unions, and the unions are supposed to help, all their members when they pay membership. As long as you're a member, you're supposed to have that representation. I found out with the NHS, it gets to a point where the unions drop out, because you find that sometimes the representatives from the unions do not have the necessary knowledge to actually represent somebody, going through the process. And sometimes this case gets to a point and they drop the person and say, we can't continue with the case. So the person has to look for that support elsewhere. They usually end up being thrown out or being demoted or being sent to another department altogether. So what I'm going to talk about this evening is about case studies. Okay, and these case studies are just, examples I've picked out from the cases I've worked on, and it's what is happening currently. It's still ongoing. So I want people to understand, the different cases, how it works. I'm not saying that, it's totally dire. It's, really, really bad. There's no turning back. There are some people who go through their whole work life, through their whole employment. They don't have any issues whatsoever. They don't have any problems. And sometimes you might find that they keep to themselves, or they keep their heads down, do what is required. And, when it's time to retire, they go. And you find that, sometimes it could just be that their manager likes them and helps them and covers for them, and so that supports them through the system. But majority of the people go through similar cases I'm going to discuss this evening. So I'm going to talk first about, some of the cases I've dealt with on the NHS. Now, most of them belong to the unions, so I have to work with them from the outside. And most nurses on the NHS don't know that the help, the support is out there. And sometimes it's word of mouth. So, because if you belong to a union, you cannot go outside of the union support. So what we do is to give advice on the outside and tell them what to ask, questions to ask, what to do, and stuff like that. So my first, one of the cases I've dealt with is a manager trying to influence other staff to make representations against the staff member, the black staff member, on the issue that they're going through. So basically, the staff member was promoted to middle management, so had a number of staff under them, and because they were very good at their job, the manager started feeling a bit threatened that this junior manager is going for the job. So they started picking issues with everything they do at every point. And then when this middle management, let's call her Sarah. So when Sarah is, telling the junior staff what to do, the manager comes in and says, no, don't do that, that is wrong. Then the manager comes in and tells Sarah, oh, Sarah, you've given this person this task to do. They're not supposed to do it that way. This is the right way. Meanwhile, when she goes with what the manager's told her to do to change, the manager comes back and says, I never told you that. So what we started doing was for her to keep a diary and write exactly the day, the time when she's giving that instruction, and sometimes write an email back, but in a way that the manager does not know, that it's just evidence gathering. So she was doing that, and eventually, because the manager couldn't find a way to make her pay for the, how would I say, insolence, questioning her management skills and stuff like that, she started speaking to the other junior staff who were under her, and also her own colleagues, asking them to bring cases against this manager so that they could take her through to disciplinary and then get her out of the organization. So because we had quite a lot of cases that we could actually use at the disciplinary hearing, because she was told that she would be thrown out of the organization after 14 years of working on the NHS. And we said that is not going to happen. She went through the union helped her up to an extent, and they said, oh, we don't know what to do. By this time, it seemed as if the union was working with the organization. So what we did was to gather those evidences and then lay them out, every letter that was written, every lie that was told, everything. We replied to those letters and sent them in. At the end of the day, the panel that were put together to actually hear the disciplinary did not follow procedure, because when you're going through into a disciplinary, the person who does the investigation shouldn't be on the panel. Okay, and the person who hears the appeal should not even be involved with first and second stage. But that's what happened. At the end of the day, what they did, they saw that there was nothing they could do. They were looking for a way to push her out. Finally, because they couldn't find any reason, they decided to offer her transfer somewhere else. And she decided to just go because she doesn't really need the stress. Staying in that same place. So she went somewhere. Now, sometimes you find that, people could win their case because they have those evidences. And that is why I always tell people, when you're going through anything, if your instincts tell you that something is fishy, then something definitely is fishy. You need to start keeping a diary. You need to start being, dotting your I's and crossing your T's. Unfortunately, that is the reality of things. For her, it worked out very well for her because she moved away somewhere else where she's actually thriving and doing very, very well. She's had 2 or 3 promotions so far, and she's well liked by both the patients she works with and the managers she works with, because she's very good at what she does. But because you sometimes go into a department, you find somebody who hates your guts or hates the fact that you're very efficient and you're very principled, you do things according to policy, they don't want you there. Now, the second case was about a Black member of staff who complained about behavior from her white colleagues. So they talked to her about, her hair, that her hair was like spikes because she had this afro. And they said derogatory things about her hair. They said a lot of stuff about her. And when she complained about it, the manager, in passing, I don't know if it was a joke or it was just, they call it banter, but I don't think that is banter, said she's an authority on herself, so everybody should please avoid her. And that was the last straw, because there's been series of issues that had gone ahead, and that was the last straw, and she decided she wanted to put a grievance in. Now, this case is very unique because of the different things that happened. I would not go into those other areas because it will out the person. Now, one thing I want to say to people is that when you are bringing forward a grievance, you have to identify those ones that would carry a lot of weight. When people bring in both serious things and things that are very trivial together, it actually weakens the case. So you have to be you have to be really sure. So those things like saying, avoid her, she's an authority on herself, and talking about her hair, it is in the policies. You can't do that. That is bullying and harassment. That can happen. And there are ways to go about that. That happens. Don't join, even if you join in the banter, it's also something that they call it banter, but I don't call it banter. But for want of a better word, I'll call it banter. When you join in those kind of exchange, they would say, oh, but she was laughing or he was laughing when we were saying it. But that doesn't make it right. People laugh because they want to diffuse the situation. They laugh because they don't want to cause any friction, or they feel uncomfortable, and that's the only way they can deal with the issue. So as somebody who is an ethnic minority, that happens. Quietly, politely, or firmly, you tell them that that's not funny. No smile, nothing, and you walk away. If you feel so strongly about it, then speak to a manager and tell the manager that, this isn't right. I can't do this. So I've just gone into the slide. So speak to your manager about the behavior. Speak to, if the manager is part of that so-called banter, speak to their manager. If their manager is not willing to handle the case, then put in a grievance, put a complaint in, which will be regarded as a grievance, and they are duty bound to investigate it. Another thing is for people to know the policy, know the process, because some people go through work and they don't know anything about the policies in their organization. Different trusts might have different ways of doing things. What is in the policy most of the time is not what is done in practice. Okay, so if that happens, make sure you know your policies inside out. You're going to your union rep. Don't just sit back and expect the rep to do everything for you. You need to do your research. You need to find out things about what is happening, what is done, even if you have to go outside of the organization and research that, because the process is the same. It's just that policies are different. And then when you put in the grievance or you put in the complaint, there is a stipulated time frame where you get your response. And when you don't get it by that time or on that particular date, you send an email, or you never ever do anything verbal. You send an email, you ask the manager what is happening about this, ask for that. Follow up, follow up, follow up. Never let it slide. I know some people are scared because they feel if they say something, the issue becomes exacerbated. But it's not like that. When you ask and they don't do it, the next thing to do is to follow the process, the grievance process. Go to the next stage. Keep pushing. And if at any point you feel that this is no longer tenable, then there is redress. You can take it on. You can take your employer to tribunal. Thank God for tribunals. You can take your employer to tribunal for that particular issue. The process is to go through to ACAS. They will try mediation first. And if it doesn't work, then you go through, they'll give you a reference number which takes you through to tribunal. Now, tribunal is another process and is very stressful. But before you start thinking about going to tribunal, you have to ask yourself, do you have the mental capacity to do it? Because it's so stressful, people can get depressed, people can have mental health issues. So you have to be sure that you have the capacity, you have the financial background to do it, you have the will, and you have people who can support you through it. If you don't have that and you're not strong in spirit, or you don't have God in your heart, you will not make it. So usually I ask people when they come to me and they say, I want to go to tribunal, I ask them, do you think you can do it? Do you have mental capacity? Do you think you're strong enough in spirit? Do you have people who can support you? If you don't, then don't go down that route. What do you want out of it? That's the main thing. What do you want out of the process? It's a question everybody must ask themselves at every point. I go on to patient cases. So
okay, time is pushing on. We might have to come
very
back round to you.
Yeah, go on to patient cases very quickly. This patient challenged their treatment, and they were moved to another facility far away from the hospital where they were admitted, and nothing could be done about it. The patient came and spoke and said, this is what is happening. But that time they'd already started the whole process, had a meeting with the doctor and said, can we stop the move until we get to the bottom of this thing? They said there are no more beds. They moved her. They need to move somebody else into that particular space. The person was sicker than this person. They had to move the lady. I looked at the mileage between the hospital and this person's house. It wasn't too much, but they would give her a taxi. And I said, take the taxi, because you're already stressed and you're sick. You cannot deal with that right now. You need to move. Do you want to go through PALS? So PALS is the patient's advice and I'm sorry, just hold on. Is the patient advice and liaison service. It's called PALS. And patients can go through there and make a complaint, and it has to be investigated. So she made a complaint. That is still ongoing. We're still working on that one. Sometimes there's this other case where the nurses left the patient's treatment dressings on the ground for 24 hours and didn't answer the bell because they had challenged the treatment they'd given to them earlier. Now, usually it won't be the nurses who have done that particular, who the patient has complained against. It would be the colleagues who would actually, deal with the patient. And this patient came to me and said, this is what is happening. What do I do? Again, I referred her on to PALS. I said, because it happened, it's not the people who've done it, it's the colleagues. So if you want to go through PALS, tell them that this is what is happening. So they put in the complaint, and thank God, because the way they handled it, the people from PALS handled it, everything was resolved. And she goes in now, she doesn't have any issues. Now, in terms of the patients, what I want them to do is, when they see that, this is happening, speak to the nurse and tell them how you feel. If the nurse is not listening, then speak to the ward manager. That is the next step. You have to follow those steps. If the ward manager is not listening, then you can then go straight. You could cut out all this process and go straight to PALS and complain, and they would investigate it and then follow up. Don't just think because you've left the hospital that is okay, because the next time you come, they have long memories, it will continue. You need to start looking after yourself as a Black patient. So thank you very much for giving me the chance. Those are my details on the slide. If you want to get in touch with me, and it's also in the chat, I'll be very happy to speak to anybody after this. Well, for those people who are in the UK. Thank you.
Thank you, Hilario. Fantastic works that you're doing. Absolutely amazing. Thank you for all of that advice. And I'm sure, some of the people watching will find that advice very useful for themselves, or maybe for someone they know. It's good to know the steps and the procedures and the processes. Wow, wow, wow. On the one hand, we were hearing from Dr. Vivian about the racism and discrimination that she'd actually uncovered within the NHS as a result of doing her own research, and how she herself became victim of racism. And then we heard from Hilario the extent to which racism made her ill. Oh my gosh, a lot of the sicknesses that our people are actually experiencing, as you were saying, Hilario, could be down to the racism that they're having to endure within the workplace. They're internalizing all of that stress, all of that hurt, all of that emotion is being internalized and impacting on their health. Let's quickly go over to the chat, and then we're going to go over to our resident panel members. Rise up, Aga Tours in the house. Our sister Aga is saying, I do not subscribe to their labels, for example, ethnic minority. I'm part of a majority BAME, and I am certainly not a BAME. We are of the protected characteristics. How are they protecting us? Rise up, rise up. We've got Brother Kwame Ossi, who has been posting quite a bit in the chat. Rise up, Kwame. He's saying, please, it is not racism. It is Afrophobia. Okay, it's not racism, it's Afrophobia. Please define Afrophobia for those who may not be familiar with the terminology. And Kwame is also saying that any Black person who surrenders their healthcare to the anti-African NHS does not understand warfare. So you can hear from that, from Brother Kwame's perspective, we are at war. And it may be that most of us don't realize it. And those who are supposedly responsible for our health, do not have our best interest at heart. And here we are surrendering ourselves to people who don't look like us, don't like us. And then we wonder why we get the treatment that we are getting. He'd probably go on to say that, it's an illusion that, they have created that suggests that we are entitled to and will get equal treatment from them. And such is this illusion that we've all bought into it. And so we're surprised when we get treated like underdogs, like second-class citizens, like, people who they don't like. That is a deep one there. Going on, Brother Kwame says, ask Dr. Vivian, is healthcare a form of warfare. What are your views, Dr. Vivian? Let me just ask you to respond to that question. There is healthcare.
In a nutshell, it definitely is warfare. And I hear what you say about fighting the system, but there is no alternative. I hear what you say about we're in the system or we're expecting equality. But where else would you go? But it is warfare, and we're in the fight, and we're not giving up until we win.
Ashe, Dr. Vivian, there is no alternative. Presently, you're absolutely right. There is no alternative today. But maybe when our backs are up against the wall, we will get together as a people and create the alternatives. There are thousands of us qualified working in the NHS. Why are we not coming together and setting up our own health centres, our own health surgeries, doctor surgeries, organisations and the like? Why do we buy into a system that is so inherently racist and is giving us such a shoddy service? It's sending us to our grave before our time. It's murdering our babies. The maternal, where is that you touched on it earlier, and I was looking at the works here. Black women, some reports say 5 times, some say 4 times more likely to die in childbirth. But the NHS has no target to end it. It's not anything new. This has been going on for a long time. Let's go over to our Queen Enzinger, who has some history to bring to the table as well, because this isn't a new fight, is it, Queen Enzinger?
It is totally an ongoing battle, and it's not going anywhere anytime soon. Greetings. I mean, for me, I've got 3 small bits that I want to share because I know time is running on and everybody wants to hear their views. But the majority of our people employed in the NHS are actually a big part of the problem, because we don't say anything, we keep a low radar, and we even collude sometimes against our own people with what is going on. So that is one of the factors. And, you know, the thing is, we need to understand racism is something that is entrenched in this system. These people, there's a book called Staying Power by Peter Fryer, which I would highly recommend people read. He's a white man, but it gives you a clear understanding of how they created this racist ideology against people of African heritage all over. And they have never stopped entrenching that further and further. I'm going to move on quickly because I want to share a couple of points with us. Now, in 1983, I was the health visiting representative on the Association of Black Social Workers and Allied Professionals. And we were campaigning to prevent this country from destroying Black children in Black families and removing them into care and then placing them all over this country with people who didn't look like them, didn't know anything about them. And I just want to share one quick point from that document that we submitted. It's called the Black Children in Care, Evidence to the House of Commons Social Services Committee. And this was written in March 1983. And the fight was, necessity has given birth to the Association of Black Social Workers and Allied Professionals. The members of the association believe that the experience of being Black in Britain is shaped by institutional and individual racism. We believe that institutional and individual racism permeates all aspects of services offered to the Black community by statutory and voluntary agencies alike. And there are 10 points demanding what we want to see as the change. And we're still talking about this. So clearly the change has not occurred. Now, I'm going to share with you a letter that I actually wrote to the Nursing Times. And I have to tell you, I was really surprised when they published it in its entirety. And it's called Racism Abounds in the NHS, and it was written September 1995. And I wrote in response to an article, Training in Racial Harassment Issues for Community Nurses. And that was featured in the Nursing Times on August 8th of 1995. And what they were saying is, you know, as you said about these people, they know exactly what they're doing. But the argument was to make you feel sorry for them because they, poor things, they don't know what they're doing when they're destroying other people's lives. Anyway, I'll just read on quickly. Now, I write in response to the article, Training in Racial Harassment Issues for Community Nurses. The article dealt with racism from a client and the wider society perspective. However, it failed totally to address individual and institutional racism from staff, colleagues, and managers. After working in the NHS for many years, I and many of my colleagues have concluded that the NHS is the most overtly and covertly racist service structure in the whole nation. The racism of work colleagues and many managers border on what one would expect from radical right-wing political parties. What is so disgraceful about this racism is that most white individuals and institutions do not see the problem as being within themselves. Someone else is the racist. So they laugh and joke and carry on as if all is well. These same individuals distress Black colleagues, subjecting them to difficult situations, which often result in Black workers having to take defensive action, such as going off sick. In this way, Black people are able to survive and maintain their mental health. Many white work colleagues do not want to work under the direction of Black managers. Hence, many Black people either leave the health service or do not apply to become managers. This accounts for the fact that despite the long association which Black people have had with the NHS, there are so few Black people in senior positions. I suggest that white society and the NHS in particular needs to take a sincere and honest look at their institutions. They need to examine critically what institutional racism within their structure is doing to Black people and to the service. If this is not done, then the future is very bleak for all of us, and it will be because white people are inherently racist and do not want to confront this racism. James Baldwin, an African-American author, asks in one of his essays, The Fire Next Time, what will happen if white racism isn't dealt with? I and many others can see us heading towards the fire because of white people's inherent hatred of other people simply because of their skin color. This practice is so sick and is in need of psychoanalytical critique. I hope that sincere white people will take up the challenge to deal with their own and their colleagues' racism before we get to the fire next time. As I write, I know of several Black women who are being persecuted and virtually hounded out of their jobs by white racism, sometimes with Black collusion. What I and my friends want to know is, what are senior officials in the NHS going to do about this entrenched racism? And so that letter, as I said, was published fully in its entirety in the Nursing Times, September 1995. And I'm a challenger, I'm a fighter, and I'm a warrior. And, when you organize in the health service, you're on your own, because the majority of people do not wish to lose their job, and they're not going to say much. And they're going to be asking you, why don't you just leave it? Blah, blah. You're making up enough noise. The truth is, if our ancestors, certainly from my perspective and from the continent, if our ancestors had just said, oh God, the slave master have dog and him have gone, so we're going to just sit down quiet, where would we be today? Kwame Nkrumah, Patrice Lumumba, they fought, and we have a duty to carry on that fight. Thank you, Sister Shanice.
We thank you, Queen Enzinger Asata. Thank you so, so much. So there we have some history going back 30 plus, nearly 40 years. And yet until now, very little change within the NHS. If I go over to the chat, I'm going to put up, what do we expect? Let's go over to the chat anyway, see what we've got there. Wow. People in the NHS back then, and the same when you were there, Dr. Vivian, hear no evil, see no evil, speak no evil, and think that they can love the hate out of people who have just got evilness in the core of their heart. Let's go over. So Kwame Osei, he's defined Afrophobia for us. He says, Afrophobia is an innate hatred towards African people, which manifests itself in behaviors, attitudes, beliefs, and trust, and traits that affect people of African heritage. I need to put the screen a bit bigger. Maxine, rise up. Maxine saying, Dr. Elaine Ferguson breaks down how racism affects your health. Most don't even realize the effect racism has on their health. I'm one of those people that didn't realize the effect that racism can have on your health. Oh my gosh, we've got to be there for our families, because how many of us have had family members that come home from work and, they are just so beaten up. They are just, beside themselves, not themselves, because of the racism that they're experiencing at the workplace. And it can lead to a mental breakdown, or even worse, ending up in hospital. Let's quickly scroll up a bit and see at random what we've got. 6 Foot saying, come on, family, hit the like button, share the link. Yes, please do. Kwame saying, Dr. Vivian, please confirm that all these tests, like the COVID test on African people, are fake. Somebody wants to hear your views on that. If we go down that road, I don't think you'll get this video on playback. But if our sis would like to comment on that a bit later, we look forward to hearing from you on that. Agators, rise up, sis, Dr. Vivian. I am continuing the works in the trust that I am in. Your research is always at the forefront when I am supporting colleagues in my capacity as a union rep. Your works live on, my sis, within the NHS. And we have, fighters in there who are using the evidence and the findings as a foundation for their cases as well. Brilliant. YR Productions is saying, much love and respect, family. Hope all is well. Respect to Dr. Abu and Queen Shanice. Rise up, family. Let's just scroll up randomly, see what we've got. Onzi saying, Dr. Vivian, sorry to hear your awful ordeal. God will guide you through. Well, anyway, part that one there. He goes on to say, or she goes on to say, racism is always here. It was it's what we as Black people are doing to change our mindset of the NHS. What are we doing? That was your question at the end. What are we doing? When I was looking up at the really awful statistics of the extent to which our women were dying in the hospitals, and, this huge petition that a couple of young women were behind, got over 180-something thousand people to sign their petition, had a parliamentary debate about the issue to do with, Black women being 4 times more likely to die in childbirth and lose our babies as well. This has been going on for decades. And yet still, the health ministers don't have any particular targets for the NHS to be working towards reducing this. Black women are at the highest risk of death during childbirth, but the NHS has no target to end it, according to a government report. The death rate for Black women 5 times higher than that for white women. This was what a Joint Committee on Human Rights document actually showed. And there are some case studies here about the differential treatment that we as Black women get when we go into the NHS. And, absolutely awful. These people want to talk about so-called third world countries, so-called, countries in Africa and the death rate there, when we are just as likely, so if 5 of us go, we are potentially, being killed off in the NHS. And then what's happening then? Are they using our organs? Are they taking our body parts? What on earth is going on? So we need to wake up. Standing on the sideline and doing nothing just isn't an option, because if racism isn't knocking at your door today, it may very well be knocking at your door tomorrow. So better move the scales from your eyes, take the plugs from out your ears, and open up your mouth and stand together as a people, because if we stand together, we can stamp this out. Sister Enzinger, Queen Enzinger, absolutely right. If our ancestors on the plantation, who were looking down the barrel of a gun, looking down the barrel of those cannons, decided, that, they didn't want a whipping, they didn't want to be skinned alive, they didn't want to be drawn, quartered, 2 horses, to tie up your hand and foot and go in separate directions. That's what they were risking. Yeah, for challenging the racism that they were experiencing and the awful treatment that they were getting. That is what they were risking. And all we have to do today is just open up our mouths, make up in our minds to open up our mouth and say that this will not be tolerated. Dr. Abu, thank you so much for waiting patiently. All the queens have spoken. We need to hear from you now, King. Your time.
Vudum family. Vudum.
Vudum.
I want to rise up, sister Hilario and Enzinger, It's because people like those know themselves. If you don't know yourself, you will never speak up for yourself. And this is what we have a quantity of people that work for these authority. You understand? But there's a deficiency in their quality of thinking. When they get these jobs, we have us get these jobs. We tell everybody. But and something happened to us, we keep quiet. If you go to the Caribbean and Africa, you can see pictures of them at the workplace and all of these things. But anytime one go to them, nothing that doesn't let the next family know. And that's what I'm saying. It's really terrible when you hear that medical equipment doesn't work, of no use to us. When I hear sister and the other sister and they're talking, if they were on the plantation and do what they do, they will be charged for what they call droptomania. If in a mind, they get one of them leg cut off. We are in a situation, we are not here talking about politics or religion. We are talking about our health. That should draw the attention of us. No matter what denomination we say we do all that. We should just spot on it. But what I'm saying, and I will counter it, I'm not gonna keep quiet about it. A lot of us African people are a junkie to watch. It's an addiction. The beat somebody beat every day. Whether you're working or you're working for them or you're a patient of them and you say nothing. Junkie blood. That's a behavior of a junkie. You understand? It's a shame when Sister Vivian can't even knock on the organization and said, protect me. And look how long some of them exist. So I'm not here to directly just look on the NHS. I look on us, because when I go back to Brother Milton, Brother Milton go through the same thing what the sister go through right now. Brother Carl Grant can tell you our story. His son from dehydration. And where was the black MP? Where was the black councillors? Where was clergyman? Where was the black so-called international leaders them? There's something wrong. In one of these institutions, don't get a good deal. Today is the NHS, tomorrow one and the other. But we unite. We now unite. Tick. You understand? And this is what I'm saying, Aya. These are the things and what I'm saying. We're talking about our woman dying maternity in one thing and them thing there. But we're African people. We're coming from the with the backside. You have the man on your back, It's time we change these things and realize we are going through this that him a dictate. So what does we as a people dictate for our people? We have to start to really wake up, man, because our people in the health service, both staff and patients, suffer some terrible situation. So we have to support Dr. Vivian, support Sister Hilario. We have to support Sister Enzinger. We have to support Sister Shini on the wonderful work that she's doing. You understand? To bring these things every black or African nation should be raising these issues. Imagine, keep quiet. And in a couple of weeks, we are going to sing Silence Night. What a set of mad set of either people. We're going to sing it with so energy and so, you understand? And at the same time, the night them never silent for us. Never silence. And full time we wake up and come out of the state of denial. If we come out of the state of denial, then the NHS and all these institutions cannot abuse us. Voodoo.
Voodoo, right up, Dr. Abu. Absolutely true. We need to come out of that state of denial and speak up for ourselves. Quite right indeed. And S.A. Smith is saying the same thing. And there's agreeing with Kwame Osei and saying, Kwame Osei, we have to help ourselves and save ourselves from our own demise. Why would they do it? Why would they do it? Why do we have this expectation that, they will actually save us? Have they done such a good job on our minds that, we forgot the Tuskegee, we forgot the HIV/AIDS that was triggered by smallpox? Have we forgotten, medical apartheid and all of those really awful experiments that they used to carry out on us as a people because they thought we were subhuman and didn't have any feelings? Those experiments without anesthetics. Have we forgotten, the use of, is it Depo-Vera that sterilized all of those women in Africa? Have we, what is wrong with us? Why do we not actually see the reality of what is facing us as a people and wake up and realize that we need to come together and organize ourselves differently? Childbirth, it should be the most natural thing, for us as women to do. There's no reason whatsoever why so many of our women should be dying in their hospitals giving birth, But because of time, let me park that there and go around the panel again and give each panel member about 5 minutes or so to respond to any points in the chat, any comments, or anything that's been said by one of the other speakers. Sister Hilario, let's go over to you first as you're next to me on the screen.
Yeah, I have been reading the comments in the chat with a lot of amusement, and someone asked why we can't create our own health system. That won't be possible because the NHS is so big. Where are we going to place it? Where are we going to get the equipment? We're still going to have to buy the equipment from the same people that we're saying we should work against. Now, I'm not saying that they are not racist. Yes, you have people. They are racist. The system is racist against people from ethnic minority, from ethnic communities. I don't say minority, ethnic communities, from black communities. But what we have to understand is that sometimes we have to face the reality of what is possible and what is impossible. Okay, you want to set up a hospital, the logistics involved, the funding involved. We are not united. If right now, right here in the chat, they're telling people like this something. We have 118 people watching. You have only 68 likes on this particular show, and nobody's doing that. It just shows how united we are. You want to do something that's good for the community. You won't find people who are supporting you. I have a charity for Black kidney patients, okay? And I'll tell you something. When I'm doing something, very few people turn up. Very few people are supporting that initiative. It is for us. It's not for the white community. When we blame the white man, we should also look at ourselves, because in Africa, I'm originally from Nigeria. When we're pointing at somebody, don't forget that the rest of your fingers are pointing back at you. You did mention earlier on that some people would, some of our people on the NHS work against us. That's true. That is true, because they're scared. People they think only of themselves at that point in time. Okay, you see a brother and sister going through something in an organization, everybody gives you, it's like you've got the plague suddenly. Everybody runs away. You want to set a hospital, try and put together a GoFundMe page together and ask people to sign up or to donate and see what happens. So how do we fund that hospital we're talking about? Where do we place it? We're still going to go to the same white man that we are vilifying in the chat and ask them to give us the money to put that hospital together, because we will not do it. So until we start looking inwards first, look at ourselves first. In the Bible, it says you take out the log in your eye before you remove the speck in your sister's or your brother's eye. We have to look at our own failings first before we start blaming other people. We are the problem. Until we start thinking about each other and looking at how we can support each other, prop each other up, nothing's going to happen. We can only talk. We can only curse. We keep cursing and saying the system. Yes, the system is racist. They recognize it. They're not doing anything about it because we are not doing anything about it. So we need to start realizing and stop blaming, because that is what we do. We talk, we blame, we do nothing. Thank you.
Wow, some harsh words there. What a big slap we've just had. We talk, we complain, and we do nothing. Is that the case? Is that really true? Is that where we are today? Is it the case that we can't put our own health service together? Really? Is that where we are right now? Oh my gosh, I'd have to give up and go home if I was to begin to believe that. We can do better. We absolutely must do better. And I think, the realization that the institution maybe that many of us have put all of our hopes and confidence in, when we realize, the extent to which it is working against us, maybe then we will wake up and do better. We've got our own health professionals. Dr. Vivian, what say you? Is it the case that we can't do better? All we do is talk, a good talk?
But what I will say is we can do better. Mm-hmm. We must do better. But sadly, I agree with Hilario. We won't do better. It's just the way we are. And, what happens is the white man has relied on that fact. They know that even when we start something, they know that if we don't stop, we're going to end up fighting each other anyway, so it's going to stop. They can guarantee it. There's something fundamentally flawed with us. We have to, before we can even compete and fight back in a meaningful way, we have to come together and address the issues that concerns us. Because if we were united, they would have absolutely nothing over us. But we're not at this moment in time. And I agree with everything that's been said in the chat about they don't care about us. And when I'm talking about fighting back, believe me, I know they don't care about us. There is no expectation as such in terms of they will give us equality, because like I said, they're not going to do that. They're not going to give up their power. In fighting back, what we're actually doing is saying to the white man, You're not going to hit me and get away with it. I'm going to fight you back, whatever it takes. I am not going to be silent and just accept it, you know. And it is really sad to be on this show tonight and say that we have the power to change the situation we find ourselves in, and yet we won't do it. But I don't know what it will take to finish. But there are people out there that it's not just me, it's not just Hilario, it's not just you, it's not Dr. Abu, it's not just Sister Enzinger. You know, there are lots of people out there that are trying to do the right thing, and hopefully one day, maybe it'll all come together and change will come. But it's not anytime soon, sadly, from my personal experience over the last couple of years.
Wow, family. We are hearing from some sisters who have been at the front line of the battle. They have been fighting on our behalf. They've looked behind at our people way back with their hands over their eyes, their fingers in their ears, and their lips zip. We don't come together. We don't support each other. We are our own worst enemy. And until we come together and until we realize the power that we have, be the change that we want to see, we will be in this situation because it doesn't serve the interest of those who don't look like us, don't like us, you know, to improve our situation. Because if they do, we'll be on the same level as them. Do they want that? Hell no, they don't want that. What are we going to do? Queen Enzinger. Wow.
Well, unfortunately, just Sunday gone, I was telling some people, because I'm also a member of the Global African Congress Reparations Organization. And at the Sunday meeting, I was saying just this. I mean, we have the African Cooperative Union, and there's also a young business company called Essential Farm that's trying to develop. And, you know, I'm a membership liaison officer for the African Cooperative Union, and we're trying to get people to buy small shares to build this African Cooperative Union so that, one, we can make money, we can also invest and use any surplus to assist our people. And I mean, it's like pulling teeth, trying to get our people to come on board. Same with most things that we do. I mean, I've been around, you heard me read from the Association of Black Social Workers. I joined that in 1981. And, you know, that was such a massive piece of work. They implemented race awareness training across this country, demanded imagery in schools and training institutions, black dolls for our children, proper hair and skincare. All of that was done by really active, serious workers. Most of that's just gone underground now because those who've come after haven't contributed to adding to that. So we really need to examine, self-critique ourselves as a people and fix up, because we really, nobody's going to change our condition but ourselves. So we really need to fix up. And, you know, I have a Frederick Douglass quote, which was a part of the conclusion of my thesis, is people want change without doing the work, and it's not going to happen. Thank you.
We thank you, Queen Enzinger. Oh, also adding, you know, to the view, really, that we are the ones that have got to change our attitude and, you know, do the work to bring about the improvements we want to see. I want to quote you. You said that we've got to self-critique and fix up. No one is going to change our situation. We've got to do that for ourselves, something along those lines. For real. And it comes first of all, I think, with changing our mindset. You know, we have to wake up and realize as a people, you know, that, as you said, from that quote, many of us want to see change, but we don't want to do the work to bring about the change. Change isn't going to happen that way. Is it, Dr. Abu? What say you?
Well, I know that none of the people then where work that is dunce people. Then go to school, have education, then sensible and all of them things there. But you said, who prepare us? Who counsel us when we was going into this? Who counsel us? Who brief us when we was going into these places? You know, you have to go back to Carthagena, educate grows, and you will see that the problem that you're going through is not the illiterate people. It's those who say that they are literate because they are educated only to themselves. As Marcus said, we will never know until our back against the wall. Well, it's switch around today. They will never appreciate their position until the white man push them back against the wall. You understand? Because some of us, we give up our purpose for a position. And we can't just sit here. I will not sit here and said our people is the leadership. Those call themselves leadership amongst us. Whether organization or ever, them have a great part to play. Go to where the system talking about CU. Every African organization should have share in that. If they said that Pan-Africanism and liberation, but it takes things like that some people only talk, but they don't do. Every time we wake, and understand? Because no matter what we're going into, whether we are going to into relationship, into job, into business, we need proper counseling. And our people lock that higher. Lock that. You understand? And I'm saying that the leaders in the African community, they are not they are ladder that the European used to crawl on top of us. Vudum.
Vudum, Dr. Abu. Wow. We haven't got leaders there representing us. They're just there, you know, to be crawled upon and to be wheeled out. Talking about leaders, talking about being used. You can tell at the moment coming up with a policy, isn't she? To where is it? I had a note on that to raise that today. Is trying to actually strip those of us with the British nationality of that. They want to be in a position where they can deport us and strip us of our nationality. And let me just go to the article. Here it is. Under a new draft clause added to the government's Nationality and Borders Bill, which was proposed by Home Secretary Priti Patel, or Ugly Patel, as some call her, people in the United Kingdom could be stripped of their citizenship without warning. Clause 9 of this bill is proposed. It was proposed in January and updated in November last month. Actually exempts the government from even having to give us notice of their decision to deprive us of a citizenship if the authorities believe that either they can't contact us because they don't have our correct contact details, or it's not reasonably practicable for them to do so. I know there's another one, you know, if they think that you know, it might cause a bit of problems for them. But just imagine, you're British born, yeah? You think you're safe. You think you are a citizen of this country. Little do we realize, some of us, that the very Home Office and elected representatives that some of us foolishly voted for are there plotting and scheming to come up with ways to kick us out of this country. If we think we're the first group of Africans to be living here in this country and to be booted out, you know, we just don't know our history. Wow. Okay, I'm going to go around the panel now. I'm going to ask everybody to just pull out a question or two from the chat to respond to. I know you've been keeping an eye on the chat. Ace is blazing it up at the moment. Let me pull out one and see what you're saying. This one, the most recent one says, when I was telling you all these things, some here were vexed, spent their time worrying about Afrocentric stuff. Well, you know, there's so much that we've got to worry about as people, in my opinion, because we are firefighting. There's so much happening to us, not just here in the UK, but wherever we are. And we can't only just concern ourselves with what's happening here in the UK. agree. We need to be fighting here. We need to be fighting in support of our people on the continent, the people in Australia who's been wiped out right now. You know, we are firefighting. There's fires happening in the Amazon. They're burning out the indigenous people. You know, we can't say, well, I'm not in the Amazon, so I'm not going to be paying any attention. You know, we've got to be like the Musketeers, one for one and one for all. What say you, Hilario? Pull out a question, please, from the chat.
Yeah. I think I saw something, but I actually want to address the.
Sorry, if everyone could put their phone on mute, please. My apologies. Yeah, carry on, Hilario.
I want to, address the issue of healthcare. Again, as I said before during my talk, I said that, when you are there, you need to be aware of policies. As a Black community in the UK, most of us, we don't read. We don't like to read. And we don't like to discuss anything that is that we find unpleasant. We don't want to approach it. When you tell them about something that's happening, for instance, this, I know that it is a very controversial topic right now. I did say before we started the whole thing, it's about our health. People tend to shy away from that. We don't talk about our health. We don't talk about, because we feel that when we talk about it, we'll make it a reality. We need to start talking to each other, see how we can help each other. We want to build a hospital. We have to start from somewhere. Apart from coming together united, we have to start talking to each other, because when we talk to each other, we find out what is wrong. We can identify those people that we can help within ourselves. I try to create a system where I heard when Auntie Enzinger earlier on was saying she's not going to donate. But would you donate to your own brother, sister, your child? Would you do that? You would do that. So if you would do that, then why would you not give to your own fellow brother and sister? Because for somebody to get an organ, for it to be successful, it needs to come from somebody from your own ethnic background. Okay? And it is everybody who is getting a transplant. Of course, we can use our white counterpart, we can use the white mans, we can use the Asians, but it's not as successful. It shows how strong we are as a Black race. Okay? It shows how strong we are as a Black race. So if you can donate to your child, brother, husband, sister, your cousin, why can't you donate to your next door neighbor who is a Black person, your own brother, even if it's not biological, is your own brother because you come from the same continent? Why would you not donate to them? I try to set up a system where people can actually donate to people in our own community. Nobody will come forward. I waited 10 years. I suffered. My children were 6 and 7 when I almost died twice. Because we as a community, we do not think about each other. It's the same thing. It's the same message. We don't think about each other. We have to start thinking. Because when you step forward to be a donor in the UK, you are donating to your own brother and sister. If I can share the stats, if I had it on my computer, I will share the stats so you can see how many of us are dying. In September, I lost my friend to COVID. She was a transplant patient. I lost another friend just recently. She waited for an organ. She couldn't. She was on dialysis. She couldn't wait. 25-year-old girl. No, she's not married, no children. She died. I have seen children waiting for transplant in our community. The parents are begging. Those children die. When we make statements, we have to understand the enormity of it, what we are speaking from our lips. Because what we do, if we refuse to do something, we're not doing the white man. We're actually doing it to ourselves, because it's us who are going to suffer, not the white man, because those organs go to our people. I know that because I am within that same system. The day they called me from the hospital and said, "We found a kidney for you," I knew it was mine. because it was a perfect match. It was from somebody like me. That mother did not even think that she lost her child. She just lost her son with 2 children. She agreed to organ donation. And that's why I'm sitting down here today talking to you. If you know my story, if you know what I've been through, you will change your mind. That mother, something we do not do in our community, she did it. And I'm standing here today. I saw my younger sister have a baby. I saw my niece get married. A lot of firsts for me. I'd have given up hope in 2012. And I said, Lord, whatever you want to do to me, take me. Because I think I've done enough. Because all this while I've been working in the community. I said, I'm ready to go. But my children kept me going. We have to start thinking about each other. When we make those decisions, we have to take a step back. I took a step back. I looked at my brothers and sisters suffering in the community, in the organizations, and I made a conscious decision. I don't ask them for money. I go and I do it because I feel that we need somebody who can actually stand up and speak for each and every one of us. Wherever you are, you call me, I will be there, because it is us, it is not them. So now it is us against us. Who is to blame? Who is standing for you? You have to look to people around you who look like you, who understand the issue, who understands the problem, to actually prop you up and lift you up amongst the enemies.
Can I just say, I do agree with what you've said, but I don't actually believe in giving part of my body to somebody else. I just don't. That's just me. I'm not saying people shouldn't do it if they feel that that's what they would like to do. And I really understand what you're saying, but I do masses of work in this community. In fact, just today, and tomorrow I'm going to clear out a African Saturday school that's been abandoned, and the church wants to throw away all the stuff. And we're all financing that from our own pocket. So it's not that there's many things that I do, but there's just some things that I don't actually feel able to do. So that's really all. Yeah.
Yes, yes. We're all touched by your story there, Hilaria, and, touched by the stories of others as well that you spoke of. We don't want to see anyone dying prematurely. And I think all the more reason why we need to come together and have our own hospitals. Maybe I think our people would have more confidence, in donating if we were doing that within our own hospitals, with our own doctors, and we knew what was actually happening to the organs that we're given. But because of the huge mistrust that a lot of us have in the NHS, for the reasons that we've been discussing today, and if we go back in history, it's even more macabre when you think about the treatment and the abuse that we experience as a people at the hands of the so-called professional medical sector, so there is that historic trauma that we have suffered as a people at the hands of these so-called medical institutions, and then for us to turn our bodies over to them, and take out a part to give to someone else, when they're not even saving our women, when they're giving birth to their children, one of the most natural things that a woman ought to be able to do without any complications at all. Big, strong African women going in and 5 times more likely to die than those weak, little, thin, European women who are going in and giving birth. Something all right there, so, and this is the challenge that we've got. And I think that is the biggest obstacle, the lack of confidence, the lack of trust, or the huge distrust that we have as a people in that particular profession, which is growing year on year because of the mistreatment. Look at COVID. Our BME staff and doctors at the front line without any PPE, and then being in the front line to take their vaccines and are dying in their numbers. It's a difficult one, but we certainly need to come together and we need to do better. We've got enough professionals within the field to be able to do so. You can't tell me that 10 doctors can't get together and open up a surgery, that 10 black doctors can't get together and open up, you know, a day surgery room, you know, and a counseling and advisory service and offering therapeutic teaching services to their own people. Oh, you can't tell me we can't do that. I can't believe we can't do that.
We do. There are actually Saturday lectures that go on about different diseases from medical doctors from the NHS, from our community. I actually also hold every month, one Saturday every month, I hold a medical webinar where someone comes to talk about different diseases related to kidney disease and what people can do. And just last month, I did one on medication around kidney disease and what people should be doing with the medication. But people, as I said again, we are not united. We don't like to support things like this. Someone is still asking people to like this webinar we're doing, and the likes are still very low. So people, if you're watching right now, keep liking, because that's how this show is going to move up on YouTube. Keep liking, please.
Thank you so much. Let's go over to you, Dr. Vivian. You know, pick out some comments in the chat, please. Respond maybe to some of the comments that have been made so far. What say you?
Okay, I'll just be very short. There's one comment by Amudat Barola. I think you've hit the nail on the head. And he or she basically says, we need to love each other first. And love is key. And the second comment is from XAce99X. Said, all most of you do is talk. Ace, I can honestly say to you, I didn't lose my job as a principal clinical biochemist and a senior manager in the NHS because I just talked. I lost my job because I acted. So I agree, there are a lot of people that talk, but let me encourage you, there are still a lot of people that are acting. Yes, when we act, we get our heads chopped off, but we're not going to stop fighting. So thank you very much.
We thank you, Dr. Vivian, Sister Hilario, Queen Enzinger, Dr. Abu, all of our fighters. We thank you. Had it not been for the likes of you back in the days, we would still be on the plantations today. But you know what? As much as we talk about unity today, we have to recognize that we have to try and unite in our differences. We have to learn to show each other respect and show each other love despite our differences. You know, we're not going to be able to unite, you know, as a group of people all on the same wavelength. We're going to have to be able to come together like a wave in the sea, all at different levels. That's how we're going to have to be able to move forward. But back in the days on the plantation, it wasn't the majority of us that made the change. It was the few brave ones who came together that made the change. It was the minority, you know, the pioneers, you know, those freedom fighters who were prepared to die fighting, who said, I'm going to take a stand no matter what. Like Dr. Vivian, I'm going to take a stand, even if it means I will be unpopular, even if it means that I may lose my job, even if it means, you know, that it might impact on my health because of the stress and distress that goes with it. You know, she decided, I am going to make a stand regardless because I know what is right. And what is right for my people is what I've got to do. And the work that you've done and the legacy of your work will outlive you, Dr. Vivian. We've heard from Aga Tours in the chat today that, you know, she's actually using your works in her fight. So you're still fighting within the NHS without even physically being there. You know, Dr. Abu, let's bring you in. Take yourself off mute, please, Dr. Abu.
Yeah, man. Give thanks to each and everyone. Don't blame the addict. Blame the fixer. You understand? This is what I'm saying. That no matter what I say, whether you're doctor, teacher, the addiction affect a lot of us. As I said, the problem out there with the illiterate is those that call them illiterate and they're far more open. You understand? But I'm saying I still know them because I know what they've been through. I am the European. You understand? You know, see it. They're doing because even today when we try to fix, no, look and see what Sister Dr. Vivian go through. What is she up against? The same European them. You understand? And the same African one them who them and watch her and spy and all of the thing them. European been testing this world from it and from my mother and father on it. And we can't sit down here and pretend like it's my fault. It's the European. These are the who scramble for Africa and the nasty doing on this planet. I ain't blaming nobody because I know African in a Europe undermine African European. I know see the European we must stop that. We are aware of course. Because some of us don't know that. How can we blame the symptoms? We're afraid to look at the cause. No care what nobody wants it. I born in this country and I never feel brutish yet. Voodoo.
Voodoo, Dr. Abu, rise up. Wow, Banya, but not from Anya. Yeah, they make me feel. We hear you on that one there, Dr. Abu. I've just seen a post in the chat. Please put yourself back on mute, Dr. Abu. Yeah, thank you so much. Just seen a post in the chat from Maxine Graham who says, a friend was telling me that her friend had a C-section and that they took one of her kidneys without her knowledge. She found out 4 years later. You see, and these sort of stories, they just, when they go through the community, it just makes us even more distrustful of the NHS. Imagine, you go in there for a C-section and then take out one of your kidneys as well and you're not even know. Wow, for 4 years. Right, V Warren is saying, so Sister V, rise up. She's saying, don't think it's in our tradition. That is why we don't donate organs. But things change, so things might improve in that department. So there is hope, But yeah, we hear you on that. It's probably not our tradition. Maybe, back in the days we had particular herbs that we would use, that would enable our organs to regrow. Just today when, my other half was flinging something after a little lizard. He was telling me the story of when he was little and used to cut off, what is the foot of the lizard? Cut off the tail of the lizard and the tail would grow back, right? So who's to say that we didn't have the knowledge, prior to those invasions and the destruction of our knowledge? Who's to say we didn't have the knowledge of how to grow back our limbs and parts and organs? We are just so out of our right mind as a people. We've been indoctrinated by another race of people who are so inferior compared to the longevity of us as Africans and what we had accomplished in the past and the great knowledge and the science that we had in the past. You see, so we're only operating probably at 5% of our intelligence. Who's to say that we didn't have the knowledge to grow back our limbs and our organs? Hence why, the idea of, the transplant maybe doesn't sit well with us as a people. The evidence will come in time. I'm going to give Queen Enzinger the last roundup on today's show. And then I want to thank the audience. Go ahead, Queen Enzinger.
Well, really just to encourage our people to get up, stand up, as Bob said, and fight for your rights, because the truth is, nobody's going to do it but us, and we don't want to leave this legacy of constant fighting to our children and grandchildren. I have children and grandchildren, and I have grandchildren old enough to make me a great-grand. And we don't want them having to keep fighting the same battles over and over. So every single one of us, wherever we are, we have a duty to make a contribution to the liberation struggles of our people so that we can become a free and self-determining people once again, because we were before. Thank you.
We thank you, Queen Enzinger, Dr. Abu, Dr. Vivian, Hilario. We thank you, beautiful panel members, so much for your invaluable contribution, for your amazing works, for your pioneering works, for the research, for the advice, the support, the love to our community. Queen Enzinger, for the decades, you know, that you have been working tirelessly, and you also, Dr. Abu, have been working tirelessly for decades within the community. We thank you so much. To our panel member, to our audience, our wonderful audience, we thank you so much, you know, for all of your comments, all of your support that you have shown, and the points that you have been making. We thank you so much. Yeah, so we are the ones who are going to have to do for ourselves, and, you know, for that uplifting, those uplifting comments and remarks, Queen Enzinger, we thank you so much. So keep it locked, family. All being well, we will be back next strong. It may be the last show of the year. I'm lost for dates. There might be another one before the end of the year. Then we're going to take a little time out, reformat, wheel and come again. Yeah, so we started the series. We thought it'd be about 6 to 8 strongs, or some of you might say weeks. You know, we thought it'd be 6 to 8 strongs. It's been 16 months that we've been running these panel discussions for, and wow, they've been absolutely amazing, but exhausting, I must say. But, you know, for your ongoing support. I mean, there's some of you in the chat whose names I recognize, Sister Afrophobia. You know, I don't think you've missed a single one of our shows, you know, and there may well be others, you know, or in the chat who have been with us for the long haul. Thank you all so much. And please do give us a like, put a comment outside in the description under this particular show. Give people an indication of what we've been talking about. Let them know the importance of the discussion. We want to raise awareness of the racism that exists within the NHS, because once we're aware, the hope is we will then have our mindset to do something about it. So thank you so much for joining us today. Keep it locked. Sister Shanice out of here. Panel out of here for now. More love, more power, more voodoo.
And thank you, Sister Shanice.
Thank you. Thank you.
Bye, everybody. Have a great week.
Bye for now. Bye for now.